I think there's no question that there are challenges facing us with the healthcare system. I think the Accountable Health Care Act certainly helps us address some of those issues. And the questions that we were confronted with is how much difference will it make? Will they in fact implement it? And what didn't we do in the last go-round that needs yet to be done? Issues around quality, issues around the delivery system models, issues around payment reform. So I think we would all agree that our goals are very similar: access, quality, cost containment. And the question will be over how best to find the answers to those huge challenges, and whether the change in the Congress will either impede or improve our opportunities and efforts to try and get those things under control. I certainly think the movement towards the development of accountable care organizations, I think the movement towards a better management of chronic illness and the patients that are chronically ill, the increased transparency in the system so people have information available to them about making choices are all things that we can make real improvements on in the next couple of years. I think events like today's events certainly give us that opportunity. I think constant exchange among stakeholders. This is not something that's going to be solved by one part of the puzzle. It has to involve all parts of the puzzle. In fact, one of the things I found a little disappointing was in the voting on the issues that were raised yesterday, a relatively low score for the involvement of multiple stakeholders and reaching out to stakeholders. I think at the end of the day that's what has to happen. It's the provider groups, the consumer groups, essentially getting together with the administration, with the payers and others to try and find the answers to these questions. I think it has to involve all parts of the system.